Welcome to the Breaking Burnout for Nurses podcast. My name is Bonnie Kitahata. I'm your host, and I'm so glad you're here today because what you hear from Angela, my guest, you will be able to visualize maybe yourself in another career for nursing. So, Angela Ciari, welcome. So, Angela, I work with her at TOSH, Thousand Oaks Surgical Hospital, and so I've known you for many, many years, but besides our job is in the inpatient, on the inpatient floor at a surgical hospital, you also have your side gig. So I want you to share that with us. But first, tell us a little bit about your nursing journey so far.
Well, I've been a nurse for 24 years, and 10 of those years have included being a medical aesthetic nurse. But prior to that, I was all floor nursing. And before TOSH, I was a nurse through registry. So I did registry. So I was like a super float nurse. I floated in every hospital and floor, you name it, I've been there in all of Ventura County. So I finally found my home at TOSH about 18 years ago now of experience. And what I knew, I've always been in the beauty, I've always liked the beauty industry. And I feel like medical aesthetics is the perfect combination of nursing skill and getting into that whole beauty world. So I feel like it's been very fulfilling. I'm part-time though for both. So part-time floor nurse, part-time medical aesthetics. So not too much of both. So it's perfect.
Perfect. Okay, so how did you get into that job? Did you apply for it, or did somebody approach you with that job?
I had to go to school for it. So I did a online, it was like a hybrid online slash like clinical program. It was called Medical Aesthetic Nursing and Dermatology School in Irvine. And it was pretty intense. I had to write a lot of papers. It was about a year long, and they hooked me up with seasoned MediSpa nurse who owned her own MediSpa, so I could intern there for about 6 months. So it was quite a bit of schooling. I mean, it's not like it wasn't a master's program. It was like a certificate program, but for a certificate program, I feel like that was pretty long. And then what I did to find my job was I went on like Yelp and I just typed in MediSpa around me, and whoever had an email, I emailed them my resume.
Oh, okay.
Yeah. And then
Wow.
I got an answer like in a week or two.
Wow. Okay, so
I was just lucky.
So you do have to have your RN degree before you take that course?
Oh, yes. You have to be an RN, PA, or MD, the nurse injectors.
Okay, so tell us some of the procedures that you do at your MediSpa.
Well, the most popular is Botox injections. So I do the full face Botox now just for aesthetics. There's a lot of things for Botox like headaches and sweating, which is more medical based. So I don't do that. For anything like beauty that I do inject.
Like what example?
Forehead, lifts your forehead. So you don't move much on your forehead. So you don't have these lines on the top and then your 11s. So you don't have those 11 lines, those angry.
Yeah. So you never look angry.
No, I'm angry right now. Can you tell? And then these crow's feet, so you don't get lines here. And that's like the traditional. But now there's like the jaw contouring, the latissimal bands, the nose flaring, the gummy lines, like chin, frown lines. Yeah. So I've injected myself like all over.
Oh, you have? I was going to ask you that.
Yeah, I'm my best guinea pig. So it's not as glamorous as people think it is because I have to inject myself because I don't have the time to I'm the only injector in my MediSpa also.
Oh,
so,
okay.
but I just do it when I can.
Oh my gosh. How painful is that injection?
It feels like in certain areas, the most painful for me is the glabella area because there's a lot of nerves there. I would say 6 to 7 out of 10, like a pinch pain. And the fatty areas, which is around the eyes or these areas, like 3, 2, nothing.
Okay. And you're doing those yourself to yourself too.
Yeah. It hurts more when you're doing yourself because you can't do your own pain focus.
And about how long is there like a prep thing? Do you do some kind of topical anesthetic?
For some people, they want like the lidocaine, like the BLT, the betacaine, lidocaine, tetracaine cream, but it's such a small little kit, like poke, goes away really quick. And it's forgettable pain. That's why people keep coming back. every 3 to 4 months.
Oh, okay, so you have clients just continue to come back. Okay.
Yes.
So you work for somebody at the
Yes.
MediSpa, right? So now, would you ever think of opening up your own MediSpa?
Oh yeah, I've thought about it when I started it. And then I just figured, once I become a business owner, the art goes away and the skill goes away. Now you're just running the business. So my husband's a business owner and I see his life answering phone calls and stuff. So I said no to that. So no, I've had several doctors approach me to start one up, and I think about it, and I always say no, thank you.
Yes, and you like working part-time. So is that for like a few hours a week, or how do you schedule your clients?
So I work every Monday at the MediSpa because it's a day shift, and Tuesday, Wednesday I work night shift at the hospital.
Okay,
And then
right.
yeah, and then sometimes I squeeze in like my patients on Fridays, like my overflow patients, or just like some of my friends that are like, "Can you squeeze me in?" So that's my Friday. I'm like, okay, so I'll only take like 2 or 3 patients on a Friday. But my schedule's pretty full on Monday at the MediSpa.
Okay, so Monday, MediSpa, Tuesday, Wednesday, hospital.
Yes.
So you take Thursdays off. You got to
And the
have your own
weekends, yeah.
a little time,
Mhm.
and then Friday you squeeze people in.
Yeah, because I'm
Okay.
only at the MediSpa one day, so and I get it. People are like never think about their face until they have an event.
Okay, so it sounds like you can make your own schedule at that MediSpa.
Oh, absolutely.
And what would you say, without saying the actual amount, do you make about the same amount per hour, or how,
I make
how do you charge?
I make like less per hour as a nurse, like as a MediSpa nurse per hour, but I get tips.
Okay,
Mhm.
so that adds up to, would you say equal or more?
I
Or,
would
I mean,
say
I guess it
equal.
depends.
I would still say, I mean, because I'm a night nurse and I'm seasoned nurse at the hospital, so I'm like
Mhm.
up there, on the pay scale in the
Yeah.
hospital. Like I'm over
Mhm.
20 years,
Yeah.
so I would still say like the MediSpa nursing is doesn't pay as well because I also have benefits at the hospital, and that's what's keeping me at the hospital.
Yeah. So now, if you would get benefits doing the MediSpa thing, would you be tempted to quit the hospital?
Probably not, no, because the MediSpa is 8-hour days, and I just want to get my work done, like work my 3 days and be done with it. MediSpa nursing is a different kind of stress. I can't do it all the time either. Like even though it's not physical, like hospital, it's a mental, like I get mentally tired, drained because you're always talking, and the patients I love that it's like
Yeah.
I'm like their most like the best part of their day. Oh, I'm getting my Botox. I wanted to see you so long. So I'm like so every patient I'm always on it, In hospital, you just do your thing and you chart and you do your thing, right? But it's different kind of energies.
Yes. Well, for me, if I was going to be a MediSpa nurse, I'd be nervous that they wouldn't be happy with their results. But I guess in the beginning, you probably are nervous that because it's your
Yeah,
face. I
definitely.
mean, something goes wrong, that would be so like I would feel so bad.
Oh yeah.
If
Yeah. Oh, trust
somebody,
it was very like that's why you have to get training. You
yeah,
have to get real training, and there's not just like this 1 day training that there's a lot of right now. There's online 1 day training.
yeah,
I
oh
trained for
no,
this for a long time,
yeah,
and I interned. So you really have to go to a good injector
yeah.
that knows the do's and the don'ts of how to inject.
How did you practice?
Well, through school we had clinicals. So I went to a school that offered like so students could inject them. So we had a lot, and it was supervised, of course. So we had a lot of like volunteers come into the school and get injected at our like a low cost, so we could practice on them.
Yeah,
And so
I
when you're
was.
done with that, yeah, I interned. So that's more practice. And then you always practice on family.
They're going, practice on me.
Yeah. And
Okay.
it's been fine ever since.
So now you feel very confident. Okay, so you do Botox. What
Mhm.
other procedures do you do?
Fillers and lasers.
So what's the
Yeah.
difference between, I thought Botox was a filler to fill
No.
the wrinkle.
So Botox is a neurotoxin that freezes muscles so they don't move. So it
Okay.
doesn't make a crinkle in your face. Filler is exactly what it sounds like. It's just like a gel that goes
Okay.
in the areas that has hollows or deep lines. Now they're made for contouring, helping with contouring and getting cheekbones and jaw lines. That's fun. That's like sculpting.
Oh,
It's fun because
okay.
it's immediate results. You see it right. Oh, and lips. Let's not forget the lips.
Yes, lips. Okay. Okay. And it's actually very artistic,
Yes.
right? I mean,
Mhm.
you're kind of creating the facial structure of your
Yes.
client,
Yeah.
so I think that is so amazing.
Hmm.
So it's very exciting, I think.
Yeah, it is. It's fun. It's so fun. It's rewarding. It's like a happy part of nursing. It's fabulous, glamorous, because it can get that way, but so it's draining in a way. Because I feel like when I'm there, like the office is like a turnstile, like next, 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 next. Yeah.
So about how long does each procedure take in general? Like a normal or average Botox injection? How long does
So
that
it
take?
depends. If they're just there for like the basics,
Oh, okay.
15 to 20 minutes,
Okay.
but then if they come in, they want all of this, it could be like 30 to 40 minutes.
Okay, but that's
Yeah,
still not very long. And then is
no.
there anything that they do afterwards? Like, do they have to wear a face mask or, I mean, I have no
So for
idea.
aftercare for Botox, you don't want to sweat. You don't want to lay down completely flat. You don't want to do anything face down or put any pressure on your face.
Mhm.
Just nothing to
For
disturb the
how long?
Botox. I say 4 to 6 hours.
Oh,
So
you
it's not a
just
big
kind
deal.
of sit around
Yeah.
rest for 4 to 6
Hmm.
hours. And do they stay in your office
No,
for that? Oh, okay. They just
no,
go
they
home
just
and.
go grocery shopping or whatever they need to do. Oh no, these women, they're so good at their like, oh, they get their Botox in the morning and then they do their workout, they do their Botox and they go grocery shopping. That's their routine. They
Oh,
just do.
okay. They got it down.
They
All
got it
right.
down. Yeah, I've had
Okay.
the same patients for many years that like they just come in and I know their face, like on my
Okay.
hand, I know exactly. Hmm.
So do you ever like just say, okay, you need a little bit here, or do you
Oh
just
yeah.
let them?
Oh yeah. So the crazy thing is a lot of people, they want you to tell them. They're like,
Okay.
no, you tell me. You tell me what I need. You're the expert. You tell me. And that's, there's a fine line. You don't want to offend anybody. You go, okay, you need this.
You really need this.
So what I just tell them, it's like, you want to try this. Is a really popular area right now, and it'll help this if this bothers you. No, but most people will allow me free reign. They just do. They
Well,
trust.
especially after working with you for a while, they're just like,
Oh
do what
yeah,
you need to do.
yeah. And trust me, I say no too. I say no
Uh-huh.
to some things. I go, you don't need any more lip fillers, or you don't. I mean, you don't need it.
Yay.
I'll tell them not to as well. It's too much is too much.
To hear that, because sometimes, when you see some people, you think you wish their doctor or
Oh yeah, no.
tech would have said no.
Yeah, that's
So
your work walking around out there. You don't want
yeah,
your work walking around out there. Like if
yeah,
it's like
yeah. True, because if somebody asks them, did your work, and
yeah,
they say you, and it's a botched thing, then that
yeah,
would not be good, right? So,
right.
well, Angela, thank you so much for sharing your medical aesthetic nursing journey with us. That's such a natural thing for you to be doing,
Yeah,
because you're just part of that world anyway. You kind of represent your work too, because you look
yeah.
so good, and you
Oh,
always
thank
look good
you.
even without that. You dress good, and you got the style and everything. So
Thank you.
yeah, I think you're the perfect example. So anyway, I just want to thank you again for being on my show.
You're
I would
welcome.
love to have you back, because I know there's a lot of other things that you do to nurse burnout.
For sure.
I want to have a little bit of information about you on my website. So if you nurses out there want to learn a little bit more about Angela, go to my website, www.breakingburnout.com, and we'll have a little picture of her and a little paragraph about her if you want to find out a little bit more. All right, so I'm back next Monday at 10 a.m. and we'll see you then.